There's several challenges that we face. I think the first one is probably because we are the voluntary sector, we can be perceived as not being professional. So that can mean that there's difficulties in forming relationships and difficulties in sharing information. Now we have got some good relationships in primary care, but they're often inconsistent. There may be a GP that refers to us a lot and so relates to us very well, but there may be other GPs who don't. So what we've had really is the problem of inconsistency and a problem of different cultures. We work in a very different way. We have much more of a kind of wider perspective on in this instance, domestic abuse. So I think getting GPs to recognise it might be an issue that they should be thinking about and dealing with has been a big challenge for us. Well, the IRIS project's been excellent, forming really good relationships, establishing a partnership with GPs so that we both win something. So the GP is getting a service for his patients, a good service, is learning more about the issue and is engaging in an issue that they wouldn't have engaged in before. And we are having access to women that we never met before. What's really interesting about the referrals that have come from GPs is that they are primarily women that would not come to us through our normal referral routes. They are women who I think would have not accessed a service. So what the GPs have done is enabled us to give support to women who otherwise would have been living in relationships where they could come to serious harm. We've trained GPs, we've formed really good relationships. I think we've both learned a lot about each other, and I think the learning process in itself has made the relationships better. We've both give and take, I think. We understand how GPs work better, we understand some of their constraints, and I think they appreciate what we've got to offer. So I think it's been really successful in forming a bridge between the voluntary sector and primary healthcare. I also think it's been really successful in helping GPs identify and refer patients who otherwise wouldn't have had support. The numbers are really encouraging, and the good thing is that though the research is finished, the referrals keep coming. So that relationship that we've established isn't just based on the research or the pilot, it's actually now, I think, embedded in the way we our practice and so in the way we relate to each other. We've had women who've come to us and said, I've gone to my GP, I've told them that I'm a victim of domestic abuse, and the GP said to me, you must leave. But then he or she didn't tell me where to go. So though their response was correct, the GP didn't have the information to know where to send the woman. So the woman kept saying, I didn't know where to go, I told them. I mean, we've also had women who've said, you know, I talked to my GP about it, and you know, they prescribed medicine. They've said, you know, well, it sounds like you're depressed, or it sounds like you're, you know, things aren't well at home, but. So they haven't really taken on board what she's been saying, that there is an underlying problem here about, you know, harmful relationships. So I think some women have been listened to, but not been helped any further than that because the GP didn't have the resources available. But I think some GPs still struggle to see that it is a health care issue. They see it much more about the privacy of relationships as something that they don't enter into.